Hello, welcome back. The topic today is food poison. So most of the people would have at least once experienced, saying, I had a food poison, I ate outside, I got some food poison. What is that? So food poison, of course, eating food causing some poison in the body, leading to some signs and symptoms. Okay, the signs and symptoms are, it could be, from the small, abdomen pain, mild fever, body ache to diarrhea, watery diarrhea to bloody diarrhea kind of thing, or even death. It's a huge spectrum, can happen in food poison. And most of the people think only eating outside causes food poison. No, even eating at home can cause food poison. So we'll talk detail about the food poison. So food poison is usually caused by bacteria, virus, the food causing poison. It need not be food, it could be vegetable, it could be fruits, it could be even water. They can cause poison. So mostly the food poison is caused with bacteria or virus or parasites or the toxins. We call that endotoxins from the bacteria. Bacteria, they produce sort of poison kind of thing. They are called toxins. They can cause a severe food poison. Okay. When can, suppose you eat, when can the food poison can happen? Again, it's a big spectrum. It can happen within the shortest time is 30 minutes to even 50 days. So like bacteria like Bacillus cereus, it's available. It's mostly in the non-veg or in the fruits, vegetables. They can cause food poison within 30 minutes of taking the food. Or sometimes, if it's suppose a typhoid kind of salmonella, these things happen even after 6 hours, even 2-3 days. Generally, 24 hours, this could be the general term. But Hepatitis-A, it's a virus. Again, it's usually from the food. That can happen even after 50 days. So we call the signs and symptoms to appear could range from 30 minutes to even 50 days, but generally 24 hours. Okay. So what are the signs and symptoms? First, of course, usually the history is having food outside or recooked food in the home. Usually 2 to 3 people having the same problem, or an individual can happen. And generally it starts with malaise, body tiredness, joint pains, mild fever, crampy abdomen, vomiting, nausea, diarrhea, loose motion, watery diarrhea, even sometimes blood in the motion, and if the endotoxins, the toxins, when they are getting into the bloodstream, their BP can go down, they become breathless and can cause death. So these are spectrum, but generally it's a very most of the food poisons are very self-limiting, and they are very mild one, like body pain, mild fever with crampy abdomen, diarrhea for 3 to 4 times, then automatically it settles down. You improve within 24 or 48 hours, you improve well. So these are usual history. But when to seek advice, when to go to the hospital or the doctor is if there is a fever more than 1 or 2 degrees Fahrenheit, and there is a drop in blood pressure, and you have because of the water loss, the water and electrolytes are lost, especially water and electrolytes are going because of the vomiting and diarrhea. So BP can drop, electrolytes can drop. When these things happen, or you have a blurry vision and you feel altered sensorium, you feel little groggy, then definitely you have to visit the doctor or hospital and get yourself properly treated. This is very, very, very important. And first and foremost thing in a food poison, never ever take over-the-counter medications to stop the vomiting or the diarrhea or the loose motion. The reason being, vomiting and diarrhea, I always say, it's all protective mechanism to bring out or pass out the toxins or the bad bacteria or the virus. So the body itself has an immense capacity to throw out the bacteria, virus, or to pass out the bacteria toxins. But if you stop that, so the toxin, the bacteria stays longer in the body, they can get into the blood circulation, causing severe problems. So if you suspect or if you have any diarrhea for that matter, especially diarrhea with fever, never take any medicines, especially over-the-counter medicines to stop the diarrhea unless your doctor gives. Because sometimes It could be, we are thinking about food poison. Sometimes it could be from cholera. Cholera is very common in tropical countries. So if it's from a cholera, and stopping the motion can cause dissemination of infection to the bloodstream. So signs and symptoms. So how to avoid again. So first one, whether it's a vegetable, fruits or non-vegetarian, wash them properly. Wherever you buy, wash them properly. The running water, tap water, frequent, good, wash is very, very important. And if you suspect there's a chemical coated or not, maybe probably you can try with baking soda, or even vinegar soaked water, immerse. These things can happen. Then never, unless it's a fruit, try to have everything cooked food. Always have a well cooked food, especially non-vegetarian, especially chicken and mutton. They should be cooked well, and even vegetarian should be cooked well. Of course, fruits, wash them properly and try to eat them as fresh as possible. And if possible, cook only for that particular day and finish up all the food. Don't try to store it or recook or reheat all those things. Try to avoid. If at all you want to keep it in the fridge or you want to store, avoid them. Not more than 2 days. That's the safest one. People say 4 days, 4 days, 5 days, or even the freezer you can keep it for, no. The best is 40 hours to 70 hours, maximum 40 hours, and try to avoid. Okay. And when you buy, a poultry or the non-vegetarian thing from a market, and always it should be like, always or packeted thing. Look for the short expiry date. Longer the expiry date, that means it's been stored long, and the bacteria can grow and or the viruses and bacteria can grow and cause problem. So this is the main thing. So food poison is very common. It could be very mild, from mild headache, fever, loose motion lasting for 1 day to 3 days, or even sometimes it could be a prolonged one, or even death can happen. And food poison can even happen in a vegetable, even fruits and non-vegetarian. Any food can cause food poison. And if you suspect a food poison or any diarrhea with the fever, never stop the diarrhea unless taking anti-diarrheal treatment from the over-the-counter. Don't visit the doctor. Let the doctor give the prescribe the medication. Probably if it's an infection, they will give. If it's a bacterial infection, they suspect, they will give antibiotic. And to stop the diarrhea or the crampy abdominal pain, they may give some anti-ulcer treatments like PPA. And and if you are dehydrated, they'll give you IV fluids. They will ask you to hydrate. So sometimes they'll give you some injections or even IV fluids to combat the water loss and electrolyte loss. So in a treatment, mainly the aim is to avoid dehydration and salt loss. So food poison, don't take it very easily, and don't take over-the-counter medications. Thank you.